So today kicks off our Cancer Awareness Week, and we've got lots of special things planned for the week. I've been doing tons of research, trying to get us the latest information. I think that probably everyone here has had some sort of dealings with cancer in our pets, whether it is that you've had your own pet with cancer, we've had three, or whether you know someone who's dealing with a pet with cancer, have a family member with a pet with cancer. It affects everyone, and how we deal with it will be an individual decision for each and every pet and for each and every pet owner. And that's it's it's a personal choice, and you should never feel wrong no matter what choice you make. I know it's very easy, by just the fact of being human, it's very easy to second guess what decisions you make, what you should have, could have, would have done had you known more, or were in a different financial situation or personal situation. But please never feel guilty for whatever decisions you make. And our goal here is to give you information, to empower you if you do come up against this. We are not here this week to give you individual treatment protocols for individual cancers. There are so many of them that there is no way we could cover them all, and they're not the same. So every dog with lymphoma does not get the same protocol. Every cat with squamous cell carcinoma does not get the same protocol. So it would be impossible for us to give you answers to your specific pet's issues. Okay, so let's talk a little bit about what cancer is and what the statistics are. Cancer basically is a disease where cells in the body are growing uncontrollably. The body's ability to stop them from dividing and growing has been turned off for whatever reason. And it can happen anywhere in the body, really. We see cancers in some of the strangest places sometimes, and we get some really weird ones, and we're always learning about the new cancers that are developing. So, and tumors can grow and not be a malignant cancer. They can be a benign tumor. We see a lot of those. So fatty lipomas, the fatty tumors, 99.5% of those are benign. They don't go to other places in the body. They don't spread. They don't generally break open unless they get really huge. So benign tumors don't spread and usually don't come back when they're removed. But cancerous tumors do have a high probability of reoccurrence and also spread. And unfortunately, cancer is extremely common in our pets. It is the leading natural cause of death in dogs. Approximately 50% of all dogs will be affected by cancer in their lifetime, and one report shows that 50% of dogs over the age of 10 will die from cancer. I actually think some of those stats are a little bit higher, and that is sad and shocking. Cancer in cats is less common than cancer in dogs, probably at about half the rate that we see it in dogs. But unfortunately, cancers in cats tend to be more aggressive. So when we have a cancer diagnosis in a kitty, it's a bigger problem for them. In our household, we had a 20-year-old cat diagnosed with lung cancer at the same time our 16-year-old dog was diagnosed with lung cancer. Neither of them had any chemotherapy or special treatments for it. They each survived 1 year. The kitty died at 21. The dog died at 17. Good long lives for them, but unfortunately, cancer diagnosis, and my decision for them at their ages was to not put them through any kind of surgery, chemo, radiation, and to just treat them naturally, give them good diet and supplements, and we will talk more about that as the week goes on. Lymphoma is the most common cancer in cats, followed by oral squamous cell carcinoma in the mouth and fibrosarcoma in the muscle, also known as injection site sarcoma. This is one of the reasons why we really try to limit vaccinations in kitty cats, because they do like to make tumors out of their injection sites, particularly vaccines. So how do cancer cells differ from normal cells? Well, they grow in the absence of signals telling them to grow. The body isn't telling them to grow. They're just doing it on their own, and they're kind of going crazy. It's sort of like flipping on your light switch, and you've got a strobe light thing going on, and you can't stop the strobe light. When you turn the switch back off, it just keeps doing its thing, and the switch isn't working anymore. They ignore the signals that tell them to stop dividing or to die, and they'll invade into nearby areas and destroy normal tissue. They tell blood vessels to grow toward the tumors. It's called angioneogenesis, and a lot of the herbs and cancer chemo products are actually designed to stop the new growth of those blood vessels and shut it down. If the cancer cells or the tumor does not have a blood supply, then it can't keep doing what it's doing. Cancer cells are really good at hiding from the immune system, so we have to have a really healthy, robust immune system, but these guys have a way of hiding out from it. They do have changes in their DNA, and that's why anything that we do to change DNA or damage the messenger RNA or the DNA or the mitochondria in the cells, it's a little scary, because cancer cells do start to proliferate when we have changes in the DNA. And they rely on different nutrients than normal cells, and we'll talk about that a little bit more when we get into the food part of the week, which will be probably about midweek. So what are some of the causes of cancer? Well, that's $1 million question. If we had the answer to that, maybe we could all hide out and live this perfect world where, I hope that's still going. Poo. Sorry, my Instagram shut down. So that's the $1 million question. As if we knew the answer to what caused cancer, we would put an end to it. We do know a lot of things that can contribute to cancer. And unfortunately, we live in a toxic world. We use a ton of chemicals, herbicides, pesticides. We have pollutants being spewed from industrial plants, manufacturing plants. And all of that is in our environment. We have polluted waterways. All of that contributes to toxins building up in the body. Secondhand smoke. If you live in a house with smokers, if you are a smoker, I can definitely attest to the fact that secondhand smoke, or firsthand smoke in your case, is a huge issue for causing cancer. Radiation exposure, whether it's ultraviolet radiation from the sun, from living in an area with a lot of radiation from different sources, and certainly radiation from cancer treatments. So when we do radiation treatments for ourselves or for our animals, that actually can cause other cancers to appear. So it's not a harmless therapy. And actually, some chemo medications are known to cause cancers. So while they're working to kill one cancer, they may be causing a secondary cancer. Not necessarily a great thing. Chemical flame retardants in furnishings and carpets. That's huge for our animals, because they spend all their time in close contact. If you have carpets in your household that have those flame retardants on them, if it's on your sofas and your animals are sleeping on your furniture, that's a problem for them more so than it would be for us, because they have closer contact to that. Vaccinations, over-vaccination. We definitely know that can be associated with cancer formation. Chemical additives and preservatives in the food. For years, ethoxyquin was thought to be a great additive as a preservative to pet food. It still is allowed if it's not added at the plant. Ethoxyquin is commonly used as an additive in fish meal or fish products to preserve them on the boat, and then when they come into the plant, it doesn't have to be put on the label. BHA, BHT, they are in some of the chemical pesticides that we apply to our animals topically. They are also found in food and treats on the grocery store shelves for our pets. We know that they are carcinogens, yet they're still allowed. And if you are feeding your pet a commercially processed food that has those ingredients in it, and they're eating the same thing day in and day out, those toxins are building up in their body. So it's a big issue that we don't always think about. So, that's why we're trying to educate you so that you know how to read labels and you know what to look for as far as preservatives to avoid. I've got tons of blogs on that on the Dr. Judy Morgan website. Chronic stress, and this is a big one. We probably don't think about this enough in our animals because I think we ignore their emotional state more than we should. Their emotional state is so important to their overall well-being. We have so many animals who suffer from frustration, anxiety, whether that's storm stress, separation anxiety, frustration. Oh, that's just not working. Sorry, my Instagram feed is not working. So chronic stress in our animals, we really have to look at their emotional well-being and get that straightened out however we can. Some of it has to do with their personality. Some breeds are more prone to stress and anxiety and frustration. For instance, if you have a working dog breed, you absolutely need to give them a job. If they don't have a job, they will undergo frustration. So it's really important to look at that and try to get a handle on that and make sure that they have emotional good health and mental stimulation, exercise, things that really help decrease the stress in their lives. I know that when Gwen went off to college, her little dog, who was so attached to her, was stressed most of the time, and her stress was loneliness. It didn't matter what we did. We were not important to her. Her stress was loneliness, and her stress was sadness because she missed Gwen so much. She would lay at the top of the stairs outside Gwen's bedroom door and wait for her to come home from college on the weekends. And so those are the kinds of things that we need to really be mindful of. And then probably the biggest thing that is a problem for our pets is chronic inflammation, because inflammation from any cause causes oxidative stress, and oxidative stress is recognized as one of the leading causes of cancer. So we can't ignore it. And if we have animals with chronic inflammation in their body, whether it's from obesity, arthritis, inflammatory bowel disease, that chronic oxidative stress is going to lead to the higher potential to develop cancers. So we know that there are over 100 types of cancer that we see in our animals, and it can sometimes be hard to pinpoint where they're coming from. Tomorrow we'll talk about diagnostic tests, which ones are better for different types of cancer that we're trying to find, which are good screening tests. If you have what appears to be a healthy animal and you just want to do screening tests, we've got some ideas for that we'll talk about tomorrow. Okay, so I want to talk today about warning signs for cancer in our pets, because a lot of times we don't see any warning signs. All of a sudden, we have this huge issue. And I think with our cat and our dog, who we found the lung cancers, I x-rayed them for something else. I was not looking for a cancer. They were not giving me symptoms that they had an issue. I just took x-rays. They were older animals. I took x-rays and did their lab work kind of for their annual exam and went, oh, well, that's a shock. So sometimes they give us zero symptoms. Hemangiosarcoma dogs, many of them, on the day they collapse because their tumor has ruptured, they'll have normal lab work. They have nothing on their lab work that gives you any kind of idea that they had something going on. So we're going to talk about some warning signs that we should be looking for. So any new lump, bump, or open sore, don't take it mildly. Keep an eye on those. You should examine them at least once a week, but preferably daily. And if that can be as simple as just running your hands over their body, feeling everything. And if you feel a lump, then make a note of it. We'll talk a little bit more about that tomorrow. Make a note of the size and position of that lump, and then keep an eye on it. If it's growing rapidly, you certainly want to get them in and have it checked really quickly. And if it's 1 centimeter or larger, so the size of a pea or larger, it's worth having it checked. And we'll talk about the diagnostics tomorrow. So any change in old lumps, bumps, or sores. So I think a lot of us have these old dogs that have these papillomas or warts kind of throughout their body. They tend to get more as they get older because they occur when the immune system is starting to not work as well. And they can sit there very quietly for years. But if one of them suddenly changes, if it starts oozing, the pet is just paying so much attention to it, they won't leave it alone. Absolutely have it checked. Okay. Constant licking at one toe or any other specific area. So my mother's schnauzer, 2 schnauzers ago, she just suddenly started licking one front foot. Licking. So at first we were like, oh, maybe she stepped on a bee, maybe, she's got a splinter in there. Licked. Toe looked perfectly normal. Ends up, a couple months later, the toe started to swell. It was a melanoma in the nail bed. So if you have a pet who doesn't have a history of allergies, suddenly they have one foot that they are just paying way too much attention to, get that checked out, because a lot of times there's a tumor hiding in a nail bed or in the bone in one of the toes. And they'll suddenly start paying attention to it, because what is our animal's way of dealing with infection, inflammation? They lick it. That's the only thing they know to do. They're going to pay attention to it. They're going to try to clean the area. They're going to try to make the problem go away. Pets with bladder tumors may lick the groin area. So a lot of animals that I saw in practice, especially kitty cats, who were chronically licking their abdomen at the back end, when we would get an ultrasound or an x-ray, we'd say, oh, look at that, they've got bladder stones in there. They're paying attention because they're trying to heal that area. So if your pet suddenly is just licking in the back end, let's get anal glands checked. Let's get the bladder looked at. If it's a male, let's look at the prostate. Something in that area is bothering them. So bloody discharge from anywhere: nose, mouth, penis, vulva, rectum. Nosebleeds are not very common in pets, and they should always be a warning sign to have your pet checked. It could be an autoimmune problem where they're not able to clot. It could be, they've got something else like von Willebrand's disease, but it also could be a cancer or some sort of a mass up in the nose. Many pets with dental disease will have really stinky saliva, but those with cancers along the jawline will have really bad odor, but also may have bloody saliva. It's amazing how many cats, remember, oral squamous cell carcinoma is the second most common cancer in kitty cats. It's amazing how many cats came in for a dental cleaning, and we'd get in there and go, oh no, this is more than a dental cleaning. We've got bone destruction, we've got tooth root destruction. So if you have an animal with that really bad breath and any blood in the saliva or swellings in the jaw, get it checked. Don't wait, because you may be dealing with more than just dental disease. Blood in the urine might signify a urinary tract infection, but it's amazing how many times I see a urinalysis where the pH is normal, there's no stones, and there's no white blood cells, there's no bacteria, but there's a whole bunch of red blood cells. And those red blood cells are there for a reason. What is causing that? And very commonly, it's an underlying bladder or urethral tumor. Rectal bleeding could be colitis, but it also could be a mass, particularly in the large bowel. It could be that you've got a mass in one of the anal glands. So definitely want to have that checked. And dark black tarry stools are an indication of bleeding higher in the digestive tract. So I've seen this in pets with carcinomas in the stomach, and they're not that common, but we do see quite a few of them. So you want to be looking at the poop every day. Don't just send your guys out to do their thing and never look at that. If they have weight loss without a diet change, some people just expect their pets as they age to lose weight. However, they really shouldn't. There's generally an underlying problem going on. They may have muscle wasting as they age, but if they're really losing weight and getting very thin and ribby, then we need to look at what else might be underlying that problem. And your pet should be weighed every single time they go into the veterinary office. If you have a smaller pet, you can weigh them on your scale at home. One way to weigh them is weigh yourself, pick them up, weigh the two of you together, subtract you back out, you got your pet's weight. Our guys are small enough. We have a kitchen scale that goes up to 50 pounds, so I put a little basket on there, and that's how I weigh our guys now that I don't have a digital office scale. If your pet has a bloated abdomen, now certainly we get muscle weakness and what appears to be a bloated abdomen in dogs with Cushing's disease, but if all of a sudden your pet looks like they swallowed a beach ball, somebody emailed me a couple of weeks ago and said on their cat they could feel these two really big lumps right behind the rib cage, one on each side. Well, those two really big lumps ended up being kidneys with lymphoma in them. And so the cat had this swollen belly, but it was really two giant kidneys filled with lymphoma. Certainly, if we have a liver cancer, they can get what we call ascites, which is a fluid buildup in the abdomen. We can also see that with advanced heart disease. So you have to figure out which is causing it. With animals that have a ruptured hemangiosarcoma, whether it's on the liver, the spleen, the kidney, wherever it is, their abdomen may fill up with blood and they will suddenly look like they swallowed a basketball. So if they are producing fluid in the abdomen, it's a pretty easy diagnosis for your veterinarian. Sometimes you can feel it if it's enough. An x-ray or an ultrasound would definitely tell you whether that is happening. And you definitely want them to get a sample of that fluid and send it out to the lab so that they can look for any abnormal cells in there. So loss of appetite. If your pet has always been a good eater and suddenly they're turning their nose up at their food, if you get lab work done, they don't have kidney disease, they don't have liver disease, they may have perfectly normal lab work, but all of a sudden they're not eating. They're not eating for a reason. And a lot of times that reason is they just feel crappy. And there's an underlying mass somewhere that we don't know about, maybe in the bowel, but it could also be, I'll never forget one of my technicians had a big Australian Shepherd, I think he was. And she said, boy, his arthritis just seems like it's really bad. He's having a real hard time getting around. She brought him into the office and I started my physical exam. As soon as I palpated his abdomen, I said, I think his problem might be this very large mass. He was a big fluffy dog, so she couldn't tell that his abdomen was bigger. He had an 11-pound mass in his spleen, a hemangiosarcoma. It had not ruptured, thankfully. But he was carrying around an 11-pound mass. And of course he was having trouble getting up. He didn't have much energy. His appetite was a little off. So sometimes the signs can be very subtle and we're not barking up the right tree when we're looking for the problem. So she was a trained technician, very good technician. She was thinking her older dog was not getting around as much because he had arthritis, when in reality he had a very serious cancer. We went to surgery that day and took it out. So straining to urinate or defecate. Straining to urinate, again, could be urinary tract infection, but it also could be stones, but it could be an enlarged prostate. It could be a mass blocking the outflow from the bladder. So if they're straining, particularly to urinate, if they're not getting urine out, that's an emergency, get them in. For animals, and this is don't think I've ever seen prostate disease in a cat, but for dogs, one of the clues that you might get with a prostatic problem would be a flattened stool. So it comes out more like a flat ribbon instead of being a nice round chunk. So weakness or loss of energy, like I talked about with my technician's dog. A foul odor. Foul odor from somewhere, anywhere. Sometimes you have to search to figure out where is this odor coming from. So like I said, it could be coming from in the mouth. We see a lot of cancers in the tonsils, unfortunately. But cancers that have dying cells make this dead odor. It is very foul. And cancers do have a specific odor. We know that because dogs are used to sniff out cancers, and they're very good at it. So behavior changes. If your pet is hiding more, they don't want to go for their walks anymore, they're getting snippy or rude to the other animals, don't want to be petted, don't want to be picked up, they're just trying to tell us that something's not right. Pale gums, so I recommend that you check your pet's gums and tongue color every single day. And if they're normally a nice bubblegum pink and all of a sudden it's, oh my gosh, we've got white gums, well, we've probably got some bleeding somewhere and we should check into that. The other things that we can get yellow gums or yellow around the whites of the eyes, because if we have a liver cancer, we're going to get jaundice eventually, especially if it's a bile duct cancer or something like that. The other thing that, and we'll talk about this more on Wednesday, from a Chinese medicine standpoint, an advanced cancer will cause toxic heat in the body, and the tongue will be a brick red. And I seriously mean it is a brick red. And when I see these animals come in, I see that toxic heat in the tongue. I'm like, I don't care if his lab work's normal. I don't care if he's acting normal. I'm telling you, we have toxic heat somewhere in this animal and we need to find it. And that's one of the nice things about the traditional Chinese veterinary medicine, because we have more tools in our toolbox. One of the other things that I have seen very commonly, one of the first signs of dogs with lymphoma will sometimes be very red eyes. Not an eye infection, no discharge. They just come in, their eyes are so bloodshot. And a lot of times those bloodshot eyes go with that brick red tongue. So if you have an animal who, and some of these will actually suddenly go blind. Some of these diseases affect the eyes. The cancer, even though the cancer is not in the eyes, that's where it shows up, particularly if it's affecting the liver, because the eyes are the window of the liver. So if you have an animal who suddenly is having these bright red eyes, but they're not infected, they're not ulcerated, they're not dry, their vision might seem to be off, get them checked out. And these are subtle signs that most people do not associate with my pet may have cancer. Coughing, a dry, harsh cough. Particularly so with my cat and with my dog, they eventually developed that cough, but they didn't have it at the time that they were diagnosed. But that could be a sign that there's a cancer somewhere that has already spread into the lungs, or it could be a primary lung cancer. Okay, so tomorrow we're going to talk about diagnostics and different things that can be used for screening tests, different tests that can be used to actually get the diagnosis of what the cancer is, what type of cancer it is. Can cancer detection dogs detect it in other dogs? Yes. And we did have a company that did a ton of research on that, but then there were some problems within the company, not with the test as much as just within who owns the company and that sort of thing. So we don't have that anymore, unfortunately. All right, your dog had lymphoma in his tonsils, no chemo, lived 4 more years with a holistic approach. Yes, and I will tell you that I have had patients that are brought up totally holistically. Raw diet from the get-go, very clean diets, not vaccinated, given supplements, fed correctly, live a great lifestyle, and the pets can still develop cancer, and some of them at an early age. And that's where we talk about we don't know all the causes, and we do the best that we can. But if our pet develops cancer, we can't shoot ourselves and say, oh my gosh, I caused this. It's pretty rare that we physically, seriously cause it, and cancer is a chronic disease. It is something that takes time to show up. So if you give a vaccine today and he's got cancer tomorrow, it didn't come from today's vaccine. Suppressing the immune system may make it suddenly show up and be visible. But like I said, a lot of these animals, our two with the lung cancer, they had that problem for a long time because they had pretty good sized tumors on their x-rays by the time I found out about it. So it's not always easy to find. It's not always easy to know that your pet is brewing something, but we do want to do our best to keep oxidative stress at its minimum and emotional stress at its minimum and feed the cleanest diet that we can. Okay, so tomorrow we'll talk about diagnostics. We have a really jam-packed week scheduled, so hopefully you'll be able to tune in for the week, and these will stay live on Facebook. I apologize to the Instagram people. Hopefully Gwen can repost this on Instagram. I don't know why it wouldn't work this morning, but it will also be posted to YouTube, so lots of access. Everybody have a great day.